The Medical and Dental Consultant Association of Nigeria has asked the federal government to quickly take up steps that will contain the resurfaced Lassa fever outbreak in some states in Nigeria. They asked the government to make available adequate drugs for treatment of the affected persons to decrease the spread of the disease across the state of the country. This was contained in an 8-point communique issued at the end of the National Executive Council meeting of the association held in Awka, Anambra State capital. Those health workers want Nigerians to free their environment of rodents that can endanger the lives of others through the spread of Lassa fever.
Lassa fever in the country is regrettable, and let commiserate with the families of those who lost their lives as a result of this outbreak. That the relevant agencies of the federal government and state governments should quickly take steps to contain this outbreak and ensure the availability of essential drugs required for the treatment of infected persons. Mdcan is willing and ready to work with the government to address this challenge.
They also appealed to the National Assembly to hasten actions towards the passage of the Tertiary Hospital Development Bill Fund.
That there is need to accelerate action towards the passage of the Tertiary Hospital Development Bill Fund, which is being proposed, which has been drafted by Mdcan. And we believe that doing that will go a long way to improving the facilities in our hospitals, thereby enhancing the nation's healthcare delivery system, curbing brain drain, and curbing as well medical tourism. It was also observed that there's increasing need to expand the capacity and funding for undergraduate medical training in Nigeria in order to stem the tide of young Nigerians going to poorly equipped medical schools outside the shores of our country. We appeal to the government, to the National Assembly, to do something in that direction, ensuring up the allocation to the health sector. Mind you, the National Health Act recommends that at least 1% of the consolidated revenue of Nigeria should be set aside for primary intervention in the health sector. That has never been implemented. If the National Assembly can take steps to make sure that is implemented in this year's budget, it will something that all Nigerians.
Correspondent Bamidele Ajayi report that the National Executive Council of the Medical and Dental Consultant Association of Nigeria also challenged the federal government to come up with plans that will end herdsmen killings and end insecurity in the country.